I think this is actually why they haven't done a lot of women only studies, because we need to personalize our food. Everything has to be personalized, but not just for our sex, for us individually. So I really resonate with what you're saying, because we get this a lot in our community, which is just give me the one size fits all approach for a woman. And I'm like, no, there's no one size fits all for a woman. Here are the guidelines, which is what, I think books like yours are going to do so well. Here are the guidelines. And now you have to go one more step and customize it to you. Is that how you feel? Would that be like an accurate statement?
Yeah. And you did such a beautiful job. I think the word bioindividuality, which makes my husband cringe every time he hears it, but I just say we are unique. Our physiology is unique to each individual. Our DNA is unique. And so I think it's important to encourage women to say, here are some strategies, try them out, see how you feel. Like I said, it's this conditioning that we've encouraged people that the one size fits all works. It doesn't. And that's why writing a book is so complicated. Because you acknowledge, I'm always like, but the time I feel like I'm constantly saying, well, try this out and see how you do. I'm sure for you've got programs that are running right now. Same thing with me. And, as I'm watching women kind of get their way through being, newbies with intermittent fasting, and I can kind of predict some of the things that will come up at certain stages. But even then, there are always outliers. There's always people that maybe something's more effortless for them. Something's harder for someone else. Yeah. I think that we really need to lean into the possibility that what may work right now may not work a year from now, or might not work 6 months from now. And so I think it's important and validating for people to know that we constantly have to shift gears. And I'll give you an example. Through all of my travel, I picked up a couple parasites.
Ooh, fun.
So I got treated for that and accepted that. And then, there was this candida thing that I'm on now, which I was shocked by.
Another fun one.
Exactly. And so yesterday, I'm not exaggerating. Yeah, I'm literally like, I had my lunch and then I was going to teach a group at 1:00. And all of a sudden my skin just felt funny. I'm like, what is going on? And so I had to get on this call. Yeah, head to toe hives, no breathing problems. And all the women on this call were like, are you okay? And I'm like, I look like a lobster. I feel okay.
Must go on.
Right. But here's a great example. I'm a clinician. I'm being treated for something. I understand everything behind the scenes. And so it drove me down a rabbit hole to find out 2 weeks into a candida protocol, is this common? What is this representative? Is it a histamine response to something I ate? There's all these things. So the point of why I'm sharing this is really just to say that at this point in time, I've never had a hive in my life. And so I'm like, okay, let's roll with it. Let's try to figure out what could contribute to that. Was it something I ate? Is it the products that I'm taking for the candida? Is it, who knows? Is it because the atmospheric pressure is up today here in the part of the country I live in? I have no idea, but I'm now going to kind of experiment to see what could possibly have contributed to that.
So instead of just saying, oh, this medication I'm on or supplement I'm on must be the problem, what I hear you saying is you're curious and asking yourself questions, which I think that is the message for women, is that as you learn to time your food and your fasts and your exercise to your cycle or your lack of it, then when a symptom shows up, I really believe that we are taught to villainize symptoms. But if your body had a language that it could speak to you, it would speak to you in these symptoms. And it's telling you something. So what I hear is be curious about it, go digging for it. But it's much easier, don't you think, Cynthia, to just go into a doctor's office and be like, here are my problems, dump it on the doctor's lap, have the doctor give you a fancy name for your problems, and then give you one pill and you're out the door. And all you got to do is take that pill. Yeah. Do you think that works anymore? And do we really need to help women look at ourselves as needing a more thorough approach to health than one pill?
Obviously, you know my answer. You're probably speaking my language.
I think it's so important.
I think it's always in the context. Like if we're talking about urgent or emergent medicine, totally different. But for chronic disease management and prevention, we have to take ownership, we as patients, so that we go in there our own best advocate. Like instead of just telling me my blood sugar is high or my thyroid's underactive, it's like, okay, well, where did that stem from? Like, where did that come from? So that curiosity that I hope, and for some people, they really don't want to know. They want to come in and they want to take their pill, and that's as much as they want to think about it. They're not ready for that message. But the people that are ready to do the work, ready for the message, it really keeps going back to the same thing that we're kind of alluding to, the lifestyle piece. How does your lifestyle contribute to the symptoms you're experiencing or the disorders you're being treated for? there. And so I recognize that my parasite came from my international travel. I accept that. However, I think it's really important when women are dealing with whether it's really heavy menstrual cycles or lots of cramps or cycles that are kind of, they come and go, they're really evasive, or if it's weight gain or fatigue, that we acknowledge that our lifestyles play a role in these symptoms. It's not a blame game at all. I mean, at all.
Yeah.
I've been there. But I always look at it like, why now? Like, why is it showing up now?
Yes.
And understanding the hormonal fluctuations that go on behind the scene and how our brains are so attuned to the environments that we're living in that maybe we don't think we're particularly stressed, but our brain does.
Yeah.
And how does that look? Like, how does that show up? And so I think it really begs the conversation to really reflect on why and how these things come about. And I think most people genuinely want to understand. It's not that they want to go to their doctor's office or their healthcare provider's office, they get a pill and then they go home and they're like, okay, well, now what do I do?
Yeah.
Because I don't think what's the root cause of what's going on is really being addressed. We're just giving it a Band-Aid. And unfortunately, that's the way the traditional kind of allopathic model is. Yeah. I mean, that's certainly what I trained in. It wasn't until, years later when I had a child with life-threatening food allergies that I started to look at things a little differently. But I think each one of us want to be curious about our own bodies and we want to understand more. Like I can tell you, in fact, I was laughing right before we got on our call. There were a couple of nurse practitioner friends who were younger than me who were like, what's this progesterone thing I need to be worrying about? Why all of a sudden I'm like,
love on her. On her. She's the best hormone.
Exactly. And so I'm laughing because I'm like, well, as you're losing progesterone, maybe providing more of it will give your body a little bit of a buffer. They were like, but I'm confused. I don't know when to take it. Why do I have to take it? Why is it important? And I'm like, there's nothing wrong with taking progesterone if that's what you need to do for your body. But if it's going to help your periods, not be so heavy, the crime scene periods, or going to help your sleep, I mean, there's no shame in that. That's the one thing that I think, unfortunately, sometimes I think we can also send the message that, we shouldn't be taking any supplement, or if you have a thyroid issue and that's what's right for you, that's great. There's no judgment. But I think it's also coming from the perspective of acknowledging that sometimes you do need a little more support than just from the lifestyle piece. You may get to a point. I mean, I certainly have an underactive thyroid and I wish I didn't have Hashimoto's and it's in remission, but still, it's just one of those things I picked up along the way in perimenopause, but it's okay. I'm accepting of this. So I want to be clear that if you do have to take medication, that's okay. Or if you do need to take a supplement, that is okay.